Okay. All right, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And we've already started by placing the camera in the front of the shoulder. We have another cannula coming in the front through a part of the shoulder called the rotator interval. You can see that right there. I'm going to slip the camera around behind the biceps. That's what we just did. And now we can see the posterior aspect of the joint. You can see this blue cannula coming in the back. So I've got a spinal needle coming down. We did examine your shoulder before we started, and it was quite unstable. It would dislocate both anterior and posterior. And we can see here the articular surfaces look great. You haven't really lost any bone on the glenoid below or the humeral head up above. So this is very much what your left shoulder looked like back in June. And so now with this spinal needle, we're just checking our angle of insertion. Sometimes we use a curved inserter here, sometimes just straight. Um, it looks like we can try and go with our straight inserter here for you. I'm going to take a little instrument called a rasp, and we're going to gently roughen up the capsule here. So this little looks like one of those medieval torture devices, but it just really gently roughens up the capsule here to create a healing response. This posterior capsule is very thin. We don't want to penetrate it, so we're not trying to remove anything. We're just trying to make it more like a piece of Velcro. And as we do this, you can see how that looks. You just gently scuff it up, basically. Where we're placing this first anchor is called the posterior band of the inferior glenohumeral ligament. And if you look right here, this is the band that's going to really hopefully be tighter. See how if I push on, I can make it look a little bit tighter? Well, that's what we're going to do with our suturing technique in just a second here. That really is probably enough in terms of scuffing up the capsule. So next we'll take our scalpel and we'll show you some more in just a minute. Okay, so here is our drill guide. Next step is we're going to drill, and then after that we mallet down the suture anchor. So if you look very carefully, you'll see a little thin wire that functions as our drill. And now that we've drilled a hole, we can take our suture anchor, place it in, tap it down by hand for a second, and then we just take a mallet to complete the insertion. And this anchor just bottoms out at the guide, and then we pull back on it, pull out the inserter, or the guide, I should say. And now that gives us two strong sutures to work with. We have to seat the anchor by pulling back on both sutures, and now that's seated. And so now I'm going to take an instrument, got it, to bring some sutures anteriorly, bring one suture anteriorly anyway. Often here we'll need a second device to pass it to ourselves. And as I recall, we had to do that on your other side too. So maybe that probe you had, or I can even use this. So we're just going to move the sutures up here where I can get to them a little bit easier. Yeah, we're good. I got it. And so we'll reach in here now. And it almost doesn't matter which suture I take based on what I'm seeing here, but we'll take this one. Okay, here's our 45-degree turn to the left hook. It's loaded with a black wire that you saw almost a year ago on the other shoulder. And so this is how we're going to end up. So this is how we rehearse the stitch. We'll start here, we'll slowly rotate back. If we want to do a little bit of a shift and tighten a little bit more, we can even push a little bit more inferior. We'll pop through the capsule, just like that. And then we'll come underneath the labrum. And that's the first part of our pinch tuck, what we call our pinch tuck stitch, as taught initially by Dr. Steve Schneider. So hold the camera there. I'm going to reach in here and grab the relay now. So now outside your shoulder, we're going to load that with a stitch. Just just pull back. Yeah, just pull back on it. Yeah. Okay, so grasper. So here you can see how that blue suture is now coming through the capsule. And if you watch here, you'll see the rest of it go underneath, just like that. I like the way that looks. We're going to do this stitch as a mattress stitch, which means that I've got to take the next suture out the front also. I'm going to go ahead and take it here and push it over towards the front of the shoulder, which means pushing it this way, just to make it easy to retrieve. And so now I can come in here, and there you can see how we retrieve it right there. Okay. And so now we're going to repeat that suturing process that you just saw and create a mattress stitch. Okay, so here we are making our second stitch. You can see we want a little bit of spread between the two. This one is technically on the superior side of the inferior glenohumeral ligament. Okay, there's our good bite of the capsule. And we'll use that as our anchor point right there. Okay, here you can see how we've shortened up this posterior capsule and created an extra fold right behind the labrum. That should all heal together given a little bit of time. And remember, that's the back of your shoulder. The primary direction you are having instability is the front, but just like you have to hang a hammock on two trees to get it off the ground, we've got to put a tightening stitch here so that we can really tighten even more up here. In fact, just putting in that one stitch has already tightened up that band, but we're going to tighten it even further. So let me go off on the video for a second. Because of the way we're set up, we don't have to move the scope. We just now have to work through the cannula on the left. I'm going to slip around behind the biceps, make sure I'm behind it, just to give me room to work. That looks good. So the next step is to go ahead and place another suture anchor down low in the front. Okay, yeah. Okay, so you can see our anchor in the front here. It's black and white stripe, but basically the same type of suture, just different color. And I'm going to reach in here from the back. We'll take out this first. And now we're going to get ready to basically do the same suturing technique we did in the back. We're just going to do it in the front. Okay, so we've got our mattress stitch, our first mattress stitch in the front passed. You can see it there. This is really hopefully going to tighten up that anterior band of the inferior glenohumeral ligament. We'll get this tied, show you some more in a little bit. Okay, we've tied the first mattress stitch in the front, and that's so tight you can't even see down there anymore, so I'm happy with that. We're about to do another stitch right here. So this is our third anchor. Sometimes you just do a simple stitch, sometimes you do a mattress. We'll decide that in a minute, but I just wanted to show you the progress that we're making here. Okay, so we've tied two sutures in the front, one in the back. That actually exactly matches what we did before. Your rotator cuff is fine, no significant arthritis like we talked about. And as you look at the shoulder now, it is not only balanced with the humeral head centered over the glenoid, but it looks a lot tighter if you go back and compare to the beginning of your video. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.